Morogobum ya wiri tukerigaria Jumaine tariki 29 mutienyi wa gatana kabiri Ekeonga Chinsa Ikomi asenchira yobwenge korwa egetaseni kia Getembe korwa Catherine Nyaboga veni Nyaboga korwa somuna bwimanyiriro kevinongere korwa studio kabiri nero kwene kyabuna chibichana Mario gingo ikirachira asenchira ere yobekranu karansake obana intugo ikomoro tokumanya gatiari agenda tawateka korwa imenesco yorogongorwa gusigo segatiari togenda togukwareganira ochikonyora aso bwekranu Chinsa inyena boigo ibere chobotko bwarero natugo chaka umwe omukoro wegwodi ya Kiogoro omoske Samuel Apoko nigo aigereire bishop we diocese ya Kisii omoske osomo bishop Joseph Maira okemwa arere mono ase ugosagano abereka gosagano ase weekend yaitire nabasabe kegorgia genzi ase metandao kubatkana nechinkwana abo atugeterituka ari gochengera emokorere bwaje buna bishop ase nabo igori tukare gochengera okoiborwa kwaye komenda nigo aruroko bolya gochasa abantu komosika Maira na goteba Maira nabo atubosibore buna ondi bwensi gokwanira siasa osekorwa ebirengerero byaye iguru ya siasa
abantu baminto montegere nande nabona ari gusaba abantu baminto naye kere ko igure gento tako abo mwango kuramomo tako bo mwango kwira ni yumuntu bobe nara kwara dia chest ne constitution yetu ya Kenya ne tekiro muntu bosibore bugukwana na koereza kende yonsi kerese nkoro yae osomo yoye ige mambi yabona nataka kukwanira engana yabera bishop kara bishop arenge anniversary yaye gali musoche sabato yae ta amangana kwanete lakini orami right left wono njinara gotebanga bishop mwanyabanga bishop wetu Catholic mwanyabanga njazmata asintari mu Catholic lakini nisigete edini na nisigete abakorerwa Nyasaye and more especially you bishop Mairo egento keria kwana ni opinion yae na mwanyabanga na nainja poko ndatware opinion yae the constitution yetu neto taribaga yokuro mundo freedom of expression ya bishop na wakiarenge ne aba bishop bande Kenya bakwani na bona tigandu example na muyeria omo bishop onyeri okwanire amara ange sana iguru ya siasa akolipiuke government and whatever lakini nanya korwa abantu bamwe abo bakomoraba naro gusaba abantu baminto ngaki uyu no musombo Nyasaye as much as yakwanite ideology yae etari ko subscribe ne ya ino bari mutaigwete nga mbu yakwanite nabona ari gusaba abantu baminta maskani atoke guchi ase kanisa na maskani atoke guchi asaba somba Banyasaye ere mwanya bantu nere na bwate right yo gukwana mangana ari yakwanite nande gento kyangokiri omo bishop uyu nande na imugetegoro akasaba mabere nga onye mwambwate tebube munyabere iguyu no muntu Nyasaye nari gusaba nk'abantu baminto nakinatenenera namasikania manene ntari kukwana kende geko geje muntu ntataite kukora munde kamuranje abantu baminto ase twabeta tosike kanisa nando tukena abasomba Banyasaye
Mokonyi bomuraibensi ya Kenya Professor Abraham Kithure Kindiki nigo aralire buna abakenya chiri milioni 25 nigo bairikire no morobere osha umukonyi oyu bomuraibensi nigo atebire getambukire kigani nigo gikiranire inse yoboraibu aye Dr. William Samuel Ruto gokwana koro ase county ya Mombasa Kindiki nigo ayereire buna yo emerobere yonsi barobrete goche asenseme yo yobochenu goika ekirane bunenchira ya moyo koneke buna abakenya nkoro beri gwabare obugima chinga kitire bakogenda asinya gitari kero barwarite.
And today we are celebrating because today around 12 noon we hit the 25 million Kenyans registration mark, Kenyans who have registered for medical insurance. And if there is one transformative measure, which is going to be remembered for a long time under this administration, is universal health care and enabling as many citizens as possible to have a medical cover. It is not a small matter. We are hoping in the next 1 year we can reach 45 million. It is possible. First of all, we want to onboard and make sure as many Kenyans as possible have a public medical insurance available for them. And then the next step now is to perfect that insurance. We improve equipping hospitals, making drugs available, the health personnel issues, the reimbursement system, and making sure that facilities are reimbursed for the actual expenditure. This fine-tuning is going to be the work for the next 5 or so years. It's not going to be perfect on day one. So I am very happy that's an intervention that we have offloaded. Many governments were fearful. From President Kibaki, he tried to bring social insurance, there was resistance, he abandoned it. President Uhuru, with his Big Four, tried to introduce it, there was politics, he pulled back. I am glad we stuck out our necks, and I salute the President for being firm. This SHA is going to be the game changer. Not many countries. We are talking about half of Kenya today work on an insurance card, medical. And these are not people who are working, people who have pay slips. No, these are fishermen and pastoralists and people with no jobs.
Na magega ya baroire babere gosiria magimabo ase enyagitari enene ya Kenyatta gwetera chinchira cyo botutukanu ose magega ya barabo goito mwaziri bobo chenu umoske adendware nigo akwanire oborendi ase chinyagitari chinene che serikali gose chiri faros ase boyego aere ebitambokero byo chinyagitari ose wizara ya bachene erache kwimukya kunenchira ya moyo gotinya oborendi ase chinyagitari okwana kuro ase nyagitari enene ya Kenyatta dwara nigo boygo nekeiri abakenya buna oborendi bwabaroire nigo borachi gotingibwa na moroire otayo orachi gosiria obogima ase chinyagitari.
As a steward of the national healthcare system, we bear the sole responsibility ourselves here of protecting the lives, the rights, and the dignity of every patient. Our referral hospitals, whose CEOs are here, must not only deliver care, but they must be sanctuaries of safety and trust of our patient. What happened at Kenyatta Hospital is unacceptable. It exposed systems vulnerabilities that must be addressed, and that's why we are here, and must be addressed with urgency, transparency, and resolve. And on that note, I have directed all national referral hospitals to immediately conduct audits of their emergency response system, an audit of their security protocols, an audit of the patient monitoring and profiling, and their operations. And they must be followed with very corrective action. We are upgrading our hospital infrastructure across the board by expanding the CCTV coverage, which we have seen Kenyatta has already implemented and is continuing implementing. We will ask every person, including the police, who bring a sick patient to do us a favor, and no longer a favor, but now is a right. If you bring a patient to the emergency and casualty here, and you have picked that Kenyan from the streets, your vehicle, your ID card, your name must remain with us. We must have some sort of traceability of the patients that come to our hospitals. It will never be again where you drop a patient and you go away. No. From the moment you enter the gate, we will record your vehicle, we will record your ID card, and you will record the same.
Chinga kiechecho moskedware nigo akwanere abaruire chiminye merongene na batatu 440 23 abo bakwamete ase chinyagitari ao chinene gose chiri false chechi serikali imeyensi ya Kenya ase abaroire chimibere Ikomi noyomo 211 batigirene chiamate chiabo ase chinyagitari echo naboigo abaroire bande chimibere 30 na babere 232 babeire ose barwaliwe korendeti bakwigura kurwa chinyagitari echo igekogera tibara akanira chibesa chire babeire bakorwarirwa dore nigo atebe wizara yeyo bocheno gyo kubatana ni wizara yoboreni boime nigo chirache okora emeremamo unenchera yamo yo kumanya chiamate ne chi familia cha bantabo elio panyare kuirana goche Chinsa.
Our referral hospitals report 443 long-stay and abandoned patients. 211 of them are abandoned by their next of kin, and 232 have been discharged, but they are unable to leave our facilities, our all referral facilities, due to social or financial barriers. To us, this is not only a logistic issue, but it is a national moral dilemma. And on that, I have instructed hospitals to work closely with the Ministry of Interior, our chiefs, and community leaders, so that together we can trace families and arrange this dignified discharge and place those who cannot be reintegrated into care institutions across our country. No Kenyan, and I said no Kenyan, should die in hospital because no one came to take them home.
Na ekero insengima yare koinyora ritko ryoborore bwa hepatitis B ritko rya igoro ase kirenga ekenene omwako yoga kyarengo gukora borore obo nigo mo director general bo wizara osebwense amoyo bachenu imeyensi ya Kenya Daktari Patrick Amothi akwanero borore obo asatebire imeyensi ya Kenya abantu gwetane milioni ya monigo barware to borore obo gati abo abasubati bali abebwatira nabo igo abatumiki ba maliogo yogotindi anene mono bali bagutumika maliogo yogotindya wetera kwebeta chisindani nigo bono atebire wizara yobochenu nigo erachekonekia bunangwe na nere chancha go echancho yogotanga oborire obo gocha ase abana bake gosebe ngwerere nabo igo konekiere buna amariogo aisaini yokorwali obobweni obo yoborire obo naroro ase chinyagitari inse morobirosha Amothi nigo atebire nigo barachekonekia buna umorobire yungo tenenerore oborubweni gosoborwali oborire obo babaroira abo batali gwakani wakende gionsi.
We envision a future where every person in Kenya is aware of their hepatitis status, a future where those infected receive timely treatment. It is critical to note that 9 out of 10 children exposed to hepatitis develop chronic illness. Universal birth, dose, vaccination, routine antenatal screening, and treatment to prevent mother-to-child transmission are not optional but essential. This also aligns with the triple elimination agenda of HIV, syphilis, and hepatitis B among pregnant women and their infants. The national prevalence of hepatitis B is about 3%. Hepatitis C is heavily concentrated among people who inject drugs. Under the Universal Health Coverage Agenda, the Ministry of Health is enforcing commitment through ensuring prevention of hepatitis B by use of vaccination and harm reduction programs and decentralization of testing and treatment. We also are working to accelerate the triple elimination agenda of hepatitis B in pregnant women and children. And with the launch of the Social Health Authority to ensure that healthcare financing is equitable, efficient, and sustainable, I affirm that hepatitis services will be integrated into SHA's essential benefits package. We have made efforts to ensure that a steady supply of antivirals and other vital commodities are available to ensure that this fight is sustained. We also intend to strengthen surveillance and data systems to drive accountability.
Nara yokore Ekeonga Chinsa Ikomi asenchira yo wengo mwancho morigereria ibere na nyecho botuko bwarero harani otot nyangiri nagenda to kwareganiria yo mona na mangina ndina chokoretera asenchira yo wekera no to skar genda gotwara borigereri borobia asembero bya Getembe TV rachko gochira asembyo asegi kagetare Getembe chingoro Catherine Nyaboga Kevin Ongere kurusdia kabirnera kwane kabuna chibichana Mario Gingo ikirachira asenchira yo wekera no twara borigereri borobia tumraneri tkoria anki.
Superstores Nero eduka asorgo nguriga rwa South Nyanza yanchere amone company ya mabati Rolling Mills eyuko yabwatuka ucyase abaonia aiga ntobwate showroom asura achabwirigiriye amabati andonsialia utagete showroom yeto nigo enkale eyuerengia na boigo ekogokiriso yao chingagi ogoswasa bigakurigiriya amabati aiga ntobwate team Tembo abo bagokora imirimo ase showroom yiga babwate chingoro chingiye cyugo kwarigania na boigo cyo tebereriye kende gensi uraganie bagotebereriye company ya mabati Rolling Mills iko babwate amabati chingenjo ao ayuare ye chikala ao na boigo ayuiga bwate chi profile net gauges ao bunabono babwate normal corrugated na boigo box corrugated asibigo babwate Dumerang ayuare aye chigage emerongetato asama mabati alia ye chigage emerongibire na isaro na isato mbabwate tile profiles alia au oriental elegantal versatile gross na boigo na versatile mat MRM niko babwate lifestyle ayuago chana Roman Jinko na boigo web design babwate ligani kabwate chikala bunabone lia chako gray brick red tile red maroon sky blue na boigo na green obutambe bwe mabwate yiga niko bokolengana amo nukonyagwe customer mbabwate bintu bindi boigo ebyo ochkunyara kabo gutumika chinga cyo gwakeranya amabati yiga ase nyumba yao tutari rero ase ouru MRM showroom onyare kabo gukwerera amabati yo akomenya segeka ayo gucanye warrant na boigo ayo urakoberwa ikasure asubwango eduke yiga ya ouru superstores igiye gutoka se enyumba ya ouru complex imiyumucho yigo busongo iyo erangene duka ya Safaricom boigo ngotuka bari ase nyumba ya JM Towers iyo angene bengi ya Credit Bank asamange bakere simgwetera sete namba chabo 0111161500 Ouru Superstores, the people's choice, guaranteed lowest prices. Karibu nyumbani.
Asegeka k'emyaka 49 ebenke ya Kenya pamoja sako yabere n'omugusi negokinia omugusi ase eningo yae yabere gekurwa obukorere ase Chinsa mu buno savings loans obosemi bwo gutumika chibesam na diaspora savings ase bali Chinsa chimaiko ase wa Kenya pamoja sako yabere ogosira okonene ase abalemi ebyumbe chiskuru chikampani ao abarikire abaritayire bose bari ensemo ya pension boigo abonchereria